Good evening and welcome to this edition of Tok Piksa. Tonight our show has a Western Province focus, specifically on serious challenges in the province's health and education sectors. In health, provincial medical personnel are facing a multi-drug resistant tuberculosis crisis. And now, this crisis is being borne solely on the shoulders of the Daru General Hospital staff. While foreign partners like the Australian government have had a strong influence in the fight against TB, there is still nothing near enough in terms of effort from provincial level authorities in this fight. The epidemic is now beyond the control of hospital personnel, and Daru General has exhausted all their resources. Now they are praying for a miracle. This week, our journalist Fabian Hakalitz was in Daru conducting inquiries and assessments on the TB crisis that now has a stranglehold on the Western Province.
Daru is an island and the provincial capital of Western Province, the home of Tok Mine, the province that shares two international borders in Papua New Guinea, Indonesia's West Irian, and Australia's Torres Strait. It also has three provincial borders. The province has a large landmass of 99,000 square kilometers, with more than half covered by water, swamp, lakes and rivers, and is logistically very challenging to reach each and every hamlet and community. This has made it difficult or even impossible at times to get to the nearest health facility. According to a presentation on TB epidemiology and responses in Papua New Guinea by Dr. Randy Moke, there is still immense gap between community aid post and urban health facility if people had to receive any health services through holistic approach. Papua New Guinea's closest neighbor and a donor, Australia, has shown much support in the fight against TB. Through the strengthening health services in Western Province, much has been done to build Daru General Hospital's capacity. Diagnosis of TB cases and management have improved with early diagnosis and treatment initiation. However, the real challenge lies in ensuring patients are properly supervised in their respective communities. The escalating multi-drug resistant tuberculosis epidemic in South Fly remains a concern for staff of Daru General Hospital. Since the first cases of the dangerous TB bacteria were detected, drug resistant in 2009 and extensive drug resistant in 2012, it has increased over the past 5 years. The epidemic is now beyond their control and the hospital has exhausted resources, waiting only for miracles to happen, says Infection Control TB Committee Chairperson Galeva Sere.
Meaning that the governor, the South Fly administrator, Middle Fly, the South Fly member, the Middle Fly member, even the North Fly member, we're asking them to come together as a group now. And with the help of the provincial administration and the district administration, we should be able to fight this.
This is the worst scenario that has forced Daru General Hospital staff to stage a sit-in protest last month. The series of grievances and demands were contained in a petition presented to the hospital's board, National Health Department, Fly River Provincial Government and stakeholders. What the staff want is for the hospital board to take full ownership of staff welfare, infrastructure, accommodation, risk allowances, including the management structure.
The staff of Daru Hospital have taken this move to make it known to the stakeholders, to our government, and to the general public that multi-drug resistant and XDR drug resistant is not just a normal TB.
9 nursing staff contracted the dangerous TB bacteria. 8 multi-drug resistant TB treated at the general ward, while 1 with extensively drug resistant TB is now paralyzed for life.
We also wanted the Department of Health to take responsibility in putting the Drug Resistant TB Act in place, in which that was also one of the recommendations, and also to help us more funding.
On infrastructure, Daru Hospital has only 1 general TB ward that cannot cater for increased number of patients admitted daily. This has resulted in overcrowding in the wards. Luckily, the Australian government rescued the hospital, building the modern TB ward, taking into account infection control. This was a major step forward in TB control as well as general health service provision. However, overcrowding still remains a major problem, and some of these patients are housed in the guardian rooms located under the modern TB ward.
There is a lot of influx of patients coming from the districts as a result of district health centers not functioning at the moment. So we asked if they can review and revive the current deteriorating health facilities.
Working in a hospital where patients are admitted daily with drug-resistant TB and extensive drug-resistant TB is a risky business. Staff risk their lives, but at the same time carry out duties to fulfill their responsibilities and obligations to promote healthy living. Preventive measures are in place with safety and warning messages displayed within the hospital premises. While acknowledging efforts by the Australian government and other aid donor partners in the fight against TB, Daru General Hospital Acting Chief Executive Officer Dr. Naomi Pomat called on provincial leaders to do more and protect people's lives.
We must all work together. We must work together in harmony to combat this disease. I know we are being affected, but I want to thank you all for your loyalty. For the people we serve, they're all our people.
Daru General Hospital staff stated that the multi-drug resistant TB problem must be given priority by all levels of government and communities.
In 2014, we have 52%, and that's 42 acquired, so a total of 81 multi-drug resistant TB. XDR TB we have.
Staff of Daru General Hospital in the recent meeting are likely to summon the Fly River provincial government and the parliamentarians for negligence and failure to address the escalating tuberculosis drug-resistant issue.
We have to give the governor and the South Fly member something. These little people who are at the back of the border or the pretty villages gave them that mandate for them to be in the parliament.
That's what you want. That's what you want. That's what simply you are telling me. That we delay it and we see someone lives to die. And we see someone Davids to catch the MDR.
Center of Excellence on TB Control Program is the goal that has to be realized. This can be possible through partnership at all levels by all concerned stakeholders with strong political commitment and leadership.
You're watching Tok Piksa. The escalating drug-resistant tuberculosis crisis in Daru highlights the common inability of PNG's health system and negligence at the provincial and local level. However, National Health Deputy Secretary Dr. Paisan Dakulala says provincial stewardship is weak, deteriorating with inadequate health infrastructure, interrupted and irregular drug supply, and having to deal with a human resource crisis. He says intervention by the National Health Department will treat the wound, but to stop the wounds from reoccurring, there needs to be more collaborative effort between all levels of government and affected communities.
Papua New Guinea is ranked second in the Western Pacific region in terms of TB, which has increased in the past 5 years. According to National Health Department, the TB crisis, if not addressed urgently, will become an unmanageable national disaster. According to National Health Department Deputy Secretary Dr. Paisan Dakulala, TB is the leading cause for hospital admission and deaths in Western Province. The health system responsible for addressing TB is very fragile and has been worsening in the province while the burden has been growing.
Over the years, the challenges were because our strategies and plans and structures that we are building didn't reach many parts of our country.
While the health system to effectively control TB is weak in the province, the socio-economic factors that drive the epidemic are also high, particularly in Daru, with overcrowding and unemployment, poor housing and sanitation.
These are issues that contribute to someone developing TB, and not just someone developing TB, but once someone develops TB, these issues can also arise.
Multi-drug resistant TB and extensively drug-resistant TB are having big negative impacts on the already struggling health system in the province.
The villages there, because the health facilities there are not strong to cater for that, and so their only hope is to come to Daru Hospital and get the support and help.
While new cases are alarming, a greater concern is the increasing number of patients, but still extremely serious form of the disease, multi-drug resistant tuberculosis or MDR-TB. All 3 districts in Western Province have seen a doubling of TB case notification rates since 2011. Dr. Dakulala highlighted the challenges involved in the fight against TB, with little effort put in by the communities.
The concern that this is now continuing to rise, and the numbers have increased, and what's also disturbing was that the health staff in the hospital setting have also contacted the resistant forms of tuberculosis, the multi-drug resistant TB.
Queries have been raised by the hospital staff on their welfare, infrastructure, accommodation, risk allowances, and other administrative issues. Provincial stewardship is weak, deteriorating, and inadequate health infrastructure, along with interrupted, irregular drug supply is often observed, and the Western Province Health Service is facing a huge human resource crisis.
And so there's like a backlog of patients that still wait to come in. And so there's this challenge in terms of how they coordinate the TB process, TB work load, how they coordinate and enable patients to be even treated at the community level. That's still a big challenge for them.
The TB solution in Daru and Western Province have entered a crisis state, and drastic actions need to be taken. Evidence indicates the need for a national emergency response. Thus, the National Health Department is preparing a submission to the National Executive Council for its declaration.
We assured the staff that this is now an ongoing discussion, and what will result soon would be a structure that will be approved for new staff to come in. In fact, the acting CEO had gone on to get recruitment of nurses who have graduated recently, and so there's a number of nurses who will be going in once the structure is approved or through their system.
The multi-drug resistant TB poses a major threat to an already weak health system in Western Province, and if not immediately addressed, will be confronted with major health, political, structural and economic problems. Prime Minister Peter O'Neill is leading a campaign to create awareness among PNG's population. If there's one plan of action that is needed more urgently now than before, it is for all citizens, government, stakeholders, communities and development partners to take ownership of this problem.
You're watching Tok Piksa. We've just looked at some of the problems within the health sector of the Western Province, a result of failed systems that unfortunately can no longer cater efficiently for the people's needs and wants. Now we look at the education sector that builds the human resources of a developing country like PNG. Delays on teacher leave fares and entitlements are other results of the government's failed system. Unfortunately, corrective measures to ensure there is no repeat of the saga every year throughout the country has been lacking. We take a look now into the case of Western's South Fly district. Our journalist, Fabian Hakalitz, spoke to the teachers there. They've all said enough is enough and the national government must not deny their rights.
This week, schools throughout the country resumed the 2015 academic year. But for teachers of South Fly district in Western Province, it was a different story. A sit-in protest was held by the 300 plus teachers in the district from elementary to secondary school relating to outstanding leave fares and entitlements that wasn't even paid before the festive season. The delay in paying leave fares and entitlements was a nationwide problem for the 48,000 teachers. For this reason, the PNG Teachers Association declared a strike. EMTV was present on ground and were able to capture them. Teachers claim delay of payments is ongoing and must stop because they can walk out of the classroom anytime, demanding the provincial government to ensure all leave fares and entitlements are paid on time. Western Province PNG Teachers Association President Rose Keani said that the Fly River provincial government failed to address their demands. 1 million kina was given by the national government to the provincial government. However, it sat at their accounts for too long.
Even if they write and tell us that, assure us that you go back to classes on this date, we'll pay you, we won't believe in that. We want to see it in black and white, and entitlements, one of our recommendation is, or demand is to be paid into teachers' account cash.
Teachers said there's ongoing issues delaying leave fares and entitlements have denied the rights to spend the festive season with their families at their respective provinces. Of the 300 plus teachers, 160 are from other provinces, some of whom have been teaching in Western Province for over 20 years now.
Come straight, and the province should be proud of what we have done here and honor the commitment it has made to give us
Teachers' leave fares and entitlements were not only the issues discussed, but a 10% deduction fee charged by third-party travel agents. It's understood that funds were to be paid to the national airline for ticketing, and should there be no flight operations, arrangements were to be made with other third-level airline. And should the ticket was issued under a travel agent, no extra, no fees or fines should be deducted, as this is a broad daylight robbery. What these travel agents were doing is illegal under the IRC tax law if they are paying monetary value of the travel budget to the teachers without deducting any tax as required by law. By deducting the 10% commission, it's a double charge, because automatically a given commission between 5 to 7%.
But then we have been denied these rights, and I don't know. When we go and question them, they say all sorts of things.
Go and use the agents to cash out their tickets. 13%, 10%, 9%. The agents become rich.
Posting teachers on promotional transfer and neglecting them is another problem that is largely influenced by Western Province difficult geographical setting. This forces teachers to teach multi-grades with no hardship allowance paid.
We are not paid remote allowance, multi-grades, disadvantage allowance.
Save the teachers properly in whatever they want, and then let them to be here to carry that burden with us.
Negligence by the education authority is a push factor for the new teacher graduates, and Southfly's ratio is declining. Then teachers staged a protest march to the provincial education office and demanded explanations from the authorities. While teachers were still outside, EMTV conducted an interview with Principal Advisor Education Natsi Bari, who claimed the Treasury Office in Kiunga failed the process of facilitating payments. However, he assured that payment should be ready by the end of this month.
Because we've been following the process of giving them the leave fares in form of tickets. That's the process that the province is. We haven't come up with another new change.
But will the same problems reoccur next year?
Although we did our part in processing all their documents and having them put in place for them to process for our teachers. And
Parliamentary Referral Committee Chairman on Education and Wabek MP Robert Ganim said investigations have already been conducted on this issue and recommendations will be presented to Parliament in this month's sitting. Some recommendations include the need to review functions of Teaching Service Commission and National Education Department, including teacher salaries, allowances and entitlements.
And that concludes our focus on the crisis in the health and education sectors of Western Province. You can view a replay of the show on Wednesday evening. And until next Sunday when we do this again, I'm Neville Choi. Good night.